Well, a good day to everybody, wherever you're joining us in the world. My name is Thami Nkadimeng, and I'll be the moderator for this section on maternal and child healthcare. When it comes to maternal healthcare, investing in the lifeline of healthy societies and economies is a must. Now we're going to go into a conversation that is quite deep, but I'm very happy that we are having this conversation so we can come up with solutions for it. An estimated 5.9 million children die each year due to malnutrition, inadequate healthcare systems, and poor sanitation. Now, all of these can be prevented if we start with platforms such as conversations like these and implementation to solutions. Now, of course, the Rotary endeavors to provide high quality healthcare to both moms, women, and children, which allows them the opportunity to live longer and to be stronger. So as Murphy's Law would have it, I'm joined by an all-female cast of panelists today, and we will be having quite a robust conversation. So let's jump right into it. Dr. Samkeliso Dube, how do you think innovation can contribute towards the betterment of healthcare systems?
Yes, you are spot on around some of the challenges that continue to bewilder the continent, but we know that digitization and innovation of some sort can actually help spur us into the next phase of our growth. So what is innovation? Innovation is obviously looking, so it's twofold, right, Thami? You could look at the things that we are doing now, how can we do them better so that we can advance, especially healthcare and the lives of people in Africa? Or we could actually get new things that we haven't invented before and new inventions into the mainstream utility or using them in the mainstream. So I think definitely we are seeing, especially in the advent of COVID-19, we are seeing many innovations, and especially in the digital world, that are spurring access to health, whether telemedicine, whether even new gadgets that actually enable people to do healthcare, especially in a different way. So innovation is the new obviously is the way we could look at how Africa could leapfrog into the next phase of its growth, and it's actually an ecosystem that needs to be created for us to actually get there, Thami. So we could slice that elephant bit by bit, first by defining what innovation is, and to then say we know that it would actually spur Africa's growth into the next phase of where we are looking at the Africa that we want.
I like that answer that you give about innovation and slicing it up. And I'm going to stay with you, Dr. Samkeliso. Do you think that innovation is directly related to technology in the healthcare system?
It certainly is, but innovation, remember, is spurred often by need. Where there is need and where there is an ecosystem that enhances that creativity amongst people who are perceiving that need, then you actually have this spark, which is innovation. So what we are seeing is that we've got technologies that become platforms that enable you then to innovate. For example, we can't talk about telemedicine when you do not have digital platforms for connectivity. It's not going to be possible. So you need some things to happen first before you can then say, my gadget that I've now invented can then solve some of the problems. It's an ecosystem. So one of the needs, actually, the first building blocks to that ecosystem is to actually have technology. And technology, in terms of especially digitization, is important. And I agree with you, Thami. It's directly linked to technology.
Thank you so much for that. We obviously know that technology can also prove to be a challenge in terms of its accessibility within Africa. I'm going to come to you, Hanan, and ask you this question. What other challenges do you think we have within strengthening the healthcare system in Africa?
Let me first thank you for inviting me for this wonderful conference, and thank you for the organizing committee. I am really delighted to be with all my colleagues. And I would like to add to my colleagues, just she said now, digital health or technology or innovation, it needs capacity building. We need to train the healthcare system team to adopt this new technology, these new ideas. Now, with digital health and mobile health, you can reach remote areas. You know, Africa is a countries with wide areas. So and you can't have everything in every small village. So sometimes we do a main system in a capital or in a city, and then we can reach the remote areas with digital health. So training, infrastructure and the training, capacity building, raise awareness for the women or for the patient or for population to use this technology and to be aware how to live safe with pure water and or clean water and proper food. So there is a lot of things to be doing as a Rotary usually do.
Thank you for that. And now you've mentioned something else that's a challenge, which is training up and above, obviously, the technology that we have spoken about. Mihaja, we have the big bad wolf COVID-19 that has obviously hit us globally and worldwide. Now, do you believe that COVID-19 has opened up further challenges or rather weaknesses in the healthcare systems?
Merci Thami pour cette question. Effectivement, le principal danger associé à une pandémie comme la Covid, c'est bien la multiplication du nombre de cas qui se traduit par une affluence dans les hôpitaux, lesquels se trouvent alors débordés, à l'instar de ce qui se passe également en Europe. Quant à la capacité hospitalière africaine, les études sur l'efficacité des centres hospitaliers du monde ont montré que sur les 11 780 premiers hôpitaux du monde, seuls 100 sont africains. Donc, la représentation que la population a de l'hôpital public est souvent péjorative, parfois même assimilée au mouroir, celui où l'on va en dernière extrémité. L'élément principal est donc la capacité de chaque pays à offrir à sa population malade une capacité d'accueil en réanimation proportionnelle à l'intensité de la propagation de la maladie. La pénurie du personnel de santé pose un énorme dilemme. L'affectation du personnel médical vers les soins COVID-19 aggrave les pénuries dans d'autres domaines. Ces pénuries pourraient avoir des conséquences plus graves que celles du Covid lui-même. Et alors que certains possèdent des réserves d'équipements rapidement mobilisables, beaucoup ont du mal à se procurer les ventilateurs, les kits de test, les lits ou bien même les masques dont ils ont besoin. Donc oui, effectivement, les guerres d'enchères internationales éclatent autour d'équipements et l'Afrique risque d'être servie en dernier, malheureusement.
Thank you so much, Mihaja. I'm going to come to you again, Dr. Samkelis, and I'm going to ask you this question after what we've heard from Mihaja. Do you believe that there's been enough solutions put in place for COVID-19 for things such as giving childbirth or things that are solely directed to maternal and child healthcare? Has enough been done during this pandemic, or do we still have a long way to go?
So thank you for that question, Thami. We know that already we have been struggling behind in issues that are related to child and infant mortality, reducing maternal mortality in Africa. We were already lagging behind. We know that strides have been made. In fact, in some places, since 2010, we have reduced maternal mortality by up to maybe 50% in the Africa region. But there are many gaps. Some gaps, especially around access to contraception, for example. So when COVID came, we were somehow left behind in covering for some of the supplies and commodities that actually would help us advance our maternal and child health in many areas in Africa. So when COVID came, everybody, as you recall, Thami, was struggling around trying to get PPE, trying to understand what this epidemic is about. And so some essential services And I know, for example, for the case of South Africa, we're actually being left behind. We haven't done enough. We are now trying to play catch up for many of the particular services around distribution of contraception, making sure that children would come in facilities for preventative care, and even for some of the diseases, you find that preventative care and screening actually were lagging behind. So we caught up that a little bit late, but now many countries and many regions in Africa are playing catch up, because now somehow we know what we are dealing with around COVID-19. So we haven't done enough. We certainly need a more hands-on approach that would decide, and intentionally so, Thami, to bring in back child and maternal mortality matters and issues back to the drawing board and back to the table.
I'm going to stick on what you're talking about, the catch-up game. And part of where we lack is the catch-up game when it comes to gender disparity on many levels, and certainly on the healthcare. So, what is it that we can do differently to close the gender disparity? And maybe you can help us, being the CEO of the Nelson Mandela's Children Fund, are there any programs that you are currently running where people can volunteer to contribute towards maternal and child healthcare?
Thank you so much for the question. In the work that we do as Nelson Mandela Children's Fund, especially focusing on the first 1,000 days of life of a child, we have been really trying to make sure that men become part of child health, and they are also becoming part of child development. We have run a couple of programs that is really encouraging men to be part of this process. One thing that we are doing, we have what we call a men's forum. This came about when we were doing community dialogues to educate communities about the importance of child health. So out of that, we're having questions from men who are saying, what is that we can do to participate in this initiatives? So what we're able to start with and including them was actually to start having some sort of a dialogue between men by men, where they can actually ask questions and answer as men. And we come in to say this is the best way of how you can do it. Because here we're talking about child health, we're talking about pregnancy, we're talking about post-pregnancy and looking at things like men accompanying the partner to the clinics, men accompanying partner when she is pregnant to make sure that he understands actually all these processes. So it is very important for men to be part of child development, because in that we were also boosting and giving the child a balanced development in terms of understanding the care, in terms of understanding and being closer to both parents. So I think it is really, really important to have men being part of these processes, and that is what we have been doing as a children's fund in that area.
Hanan, I'm going to come through to you again and ask you, how do you think we can measure the progress of healthcare for the short term? Because we need to start short term, and we'll start unpacking the long term and how to check that. But for the short term, how do we measure progress within healthcare systems in Africa?
Yeah, I think we need to use our resources. We need to make use of the diversity. We have a diversity in Africa. So I think by helping, by the Rotary itself, it do a lot even here in Egypt, and I'm sure everywhere. I have been in Addis Ababa. I visited in 2010, and I can see the great projects that Rotary do, by fundraising, help women and help societies and even the government. If we speak with the stakeholders, the policymaker can help us and can help the communities. We can learn lessons from other countries, and then how to measure. You do the plans, smart, short, with a time plan, and then you can see the indicators. There is key performance indicators, the mortality rate for children, the mortality for women. If these indicators are less than before. So you are doing well. There is benchmark to measure how many we lose fetal or babies died, or mothers or diseased. You know, if COVID-19 is our reality, but it shouldn't be our destiny. You know, I think we should work more. We should fight. We should help each other. Something like this conference, we know each other. We can exchange ideas, and that's it. That's what I have. Yeah.
That's perfect. That's really perfect. Just speaking on governments, what do you think governments should be focusing on in order to advance maternal and child healthcare?
Thank you once again for that question. I think there are a couple of things that I believe government will be able to do to improve the health system, especially for children under the age of 5, the children within the first 1,000 days of life of a child. In this case, I'm thinking about a responsible leadership, a responsible government. A government that is actually able to develop programs that are people-centered. I'm talking about government being able to invest in community-based initiatives, especially when you talk about data. And we're in an era where when you look at the impact of COVID, most of the things that we're able to use to access families, to service families, we then have to use technology. And what has been the experience for us as a fund is that we have found that it is very, very expensive for community healthcare workers to buy data. It is expensive for even community-based organizations that are working with to also buy data. So I think government come in there to strengthen the technology, especially for ordinary people, families, to be able to access family services through the community healthcare workers and buying data for community healthcare workers. So I think another point that I think is important is a multi-sectoral approach in dealing with issues. I think we cannot do it alone. As an NGO, we can't do it alone. As government, they can't do it alone. We need all of us to come together, sit around the table, bring our individual skills, bring our individual supports, and all of us work together in sharing a social objective of what is that we can do to improve the quality of life of people, especially looking at health. So I believe in supporting and investing in multi-sectoral approaches in dealing with these issues.
Thank you so much. Now, Mehaja, let's go. We're obviously here because of the Rotary today. And what is the effectiveness that the Rotary is implementing to maximize the effectiveness of maternal and childcare?
Oui, effectivement, Thami, en cas de pandémie comme la Covid, le Rotary doit se mobiliser pour la mise en place rapide d'une campagne de vaccination, travailler avec les opérateurs du secteur TIC, donc pour mettre la technologie au service de la santé, comme nous l'avons suggéré précédemment. Nous devons également toujours travailler sans relâche dans la vulgarisation des moyens de contraception. Ceci mérite évidemment beaucoup plus de temps d'études afin d'optimiser l'impact du Rotary.
Thank you for that, Mehaja. What advice do you have for Rotarians, Dr. Sangeliso? What advice do you have for Rotarians in Africa with regards to maternal and child healthcare?
It's all hands should be on deck, Thami. And I was thinking that we all ought to be involved in creating the Africa that we want. Every citizen, every Rotarian needs to wake up and know exactly what they ought to do to contribute to better healthcare. So when entrepreneurs come to the Rotarians with a proposal of something that they think could be done in their communities, support doesn't necessarily need to come in monetary forms. At times it's the link that entrepreneur with somebody who has done that before. So creating platforms for linking entrepreneurs who want to do things that actually make a difference where they stay is a one step forward. Another step forward, and to your earlier question, Thami, around how do we then measure? I believe that every citizen, actually almost every citizen now, has got access to some mobile phone or some technology somewhere. We can actually start to track People spend thousands of hours on social media, yet they could use some of that energy to say, this is the Africa that I want. So if I could say, maybe there would be a campaign, I'm a Rotarian, and this is the Africa that I want, so I'm contributing A, B, C. So I'm making sure that my street is safe, my street is clean, I'm making sure, and that is healthcare. I'm making sure my clinic actually has zero tolerance to maternal and child deaths. And for me, that's something that is meaningful. And it says I'm working up to a purpose that is bigger than myself. So I believe by being a Rotarian on its own is actually impetus for something bigger than yourself. And just have those KPIs for yourself to say, I'm going to be the change that I seek. So that's my advice to all Rotarians.
I promise you, you're living in my mind, because I was thinking about KPIs as soon as you said all hands on deck. And I thought, what is the one thing that we would say, you know, we're moving in the right direction? And I'm going to ask you this question. What is the one KPI that when you see that box is ticked, you'd say, we are moving towards the right direction when it comes to maternal and child health care?
Being healthy, you know, being healthy. I think health care now should be afforded for everyone equal, you know, and I'm not sure what is the single things, but I think health and education are two important pillars, you know, because nobody can use the social media or the Facebook or whatever whenever he doesn't know to read, you know. So education, particularly for girls, you know, education and health, and then we can have a nation where is there is development, and then, you know, I think inadequate health care and poor sanitation, where people cannot have access to clean water or inadequate food or not proper food, or not using the food because of their illness in their body, are a major problem where the Rotary can help. And it is helping indeed with a great project. But with the increasing healthcare and for children to grow stronger, I think this is a very good cause, and this is a good indicator. Yes.
Thank you indeed, Goni. I'm going to come back and stick to the same question with you, Mahaja. What advice do you have for Rotarians?
Oui, Thami, j'ai déjà donc dit tout à l'heure ce que chaque Rotarien doit faire. Le Rotary a énormément d'impact sur leurs semblables, donc je pense qu'effectivement chacun doit prendre en charge ceux qui les entourent pour avoir le maximum d'impact.
Thank you so much for that, Mahaja. Any closing remarks from you, Dr. Samkelis?
I mean, I believe that health is equal to wealth. There is no way Africa can move forward without investing in healthcare. Cracks in our systems have been shown through COVID-19. We must invest in health. As we invest in health, women and children are going to be catered for. We are going to reduce maternal mortality. By the way, there is an interesting statistic that says by reducing child mortality by just 1%, you increase your GDP by 4.6%. It's a no-brainer. By making sure that women are healthy and they are catered for, you increase, you almost even leapfrog your GDP by 10%. So for me, the closing remarks are, Africa, invest in your healthcare, invest in healthcare infrastructure, invest in human resources for health, invest in health systems that are going to stand the test of time.
I know I said that was a closing remark, but I can feel the passion in you. So I have to ask you this one last question. When you speak about investment in healthcare, do you believe that this is the role of government, or it's the role of everybody who has the capability to invest in healthcare?
So government needs to create an enabling space for investment of any kind. But governments have got a primary role to ensure that there is actually building blocks for those who are not able to be engaging in private sector, etc. Because healthcare is a social good. So there is a mandate by governments twofold. They need to invest to a certain extent to healthcare that enables or unlocks economic growth. And I think there's equipoise. When they get to a certain extent, there is need for opening up healthcare investments for everybody who is able to invest. Entrepreneurs, investors who are looking for return on their investment, innovators, everybody who actually sees even healthcare as an asset class, that where they could actually earn their millions or billions from. So I think that is for everybody, but government has that critical role of unlocking the sector and for investing things like vaccines. I think government should actually be investing in that, enabling regulatory environment for investment. Governments should surely do that. But later on, we see everybody needs to actually be playing their part, Thami. So it's a sector that's open for investment if you know what you are doing.
I'm so glad I asked you that question. I knew it was there in you to answer that one. Thank you so much for that. Hanan, any closing remarks from you?
I can't find better than the mission of Rotary. Together, we see a world where people unite and take action to create lasting change across the globe in our communities, in ourselves.
I love that. Mahaja, any closing remarks from you?
Camille, donc pour rejoindre à ce qu'a dit docteur tout à l'heure, effectivement, les décideurs politiques doivent être conscients de l'utilité et de la pérennité de leurs investissements. Les investissements dans la construction d'hôpitaux ne pourront être durables et utiles que s'ils sont accompagnés d'investissements complémentaires pour couvrir les dépenses ordinaires. Donc, les besoins non satisfaits en matière de planification familiale restent un problème de taille et doivent être comblés urgemment. Merci beaucoup.
Merci. Thank you very much, Mahaja. And last but definitely not least, do you have any closing remarks for us?
I believe we are getting there. When you talk about vaccination as a first point, I think we have done so much. And I believe we need to continue to maintain that success rate of over 80%. And we're beginning to really get into prioritizing the importance of intervening at a very early stage when coming to child development. We have learned a lot about the importance of dealing with these issues from pregnancy. So I think we're beginning and having, especially speaking for South Africa, having a program that are dedicated to deal with child and maternal health. It is important. And I think as globally, even with different countries, we're beginning to really putting more efforts, more investment in dealing with these issues. And I see hope. I believe we can actually do it as a country, as a world.
Well, there was a lot that we had to learn and listen to, and I certainly hope that it's encouraged you to want to contribute towards maternal and child care within the African continent. If you are really galvanized about contributing towards it, I encourage you to please follow the Rotary website, speak to them about how you can volunteer. This has certainly made me think a lot about the things I can do from an individual perspective, but also from a collaboration perspective. Again, my name is Thami Nkadimeng, and thank you so much for joining us on this section to do with maternal and child healthcare in Africa.